New research on Ozempic and semaglutides is raising hope for those who drink excessively. It finds the weight loss drug may also help prevent alcohol overuse and abuse. This as researchers explore whether it has the potential to treat other addictive behaviors. Ariel Reshef has more.
I have no desire to drink wine anymore, and that's crazy to me because I couldn't stop before.
The wildly popular drug used for weight loss, semaglutide, is now showing very early signs of potentially curbing alcohol use for those who drink excessively. A new case study composed of 6 people screening positive for alcohol use disorder, or AUD, found that they all saw a clinically significant decrease in symptoms while they were using semaglutide for weight loss. Christy Martin, who was not part of the study, says while she used to drink wine every night, her urge to drink has disappeared.
Drinking for me was becoming a bit of an issue, and the fact that I just have no desire for it is something I didn't expect and is just an amazing side benefit. I can't even tell you.
This small case study now setting the stage for larger clinical trials, looking at semaglutide as a treatment for AUD, as researchers explore whether the drug has the potential to treat other excessive use conditions.
And again, this initial study only included 6 patients, but as you heard, more thorough studies are already underway. It could be years before we know the true results, but certainly reason to hope. Diane?
All right, we'll take it. Ariel Reshef, thank you. And ABC News medical contributor, physician at Stanford Children's Health, Dr. Alok Patel, joins me now for more on this. Dr. Patel, break this down. What does this research really tell us about what Ozempic and what other similar drugs could possibly do for curbing drug and alcohol use?
And what this research is really adding to is this growing body of anecdotal evidence and case series reports. This is patients basically filling out questionnaires or reporting that it's possible that semaglutides and these GLP-1 agonists, this whole class of medications we've been talking about, may decrease the risk of not only alcohol use disorder, but also in other addictive behaviors as well, with some specialists citing that their patients have reported decreased incidences of shopping and gambling addiction, even smoking, even in some cases nicotine or opiate use. So this is promising, but we definitely need more research. But again, we want to see all these data come out there so we can actually have those educational academic talks about more potential uses of these medications.
It's interesting that the anecdotal responses, they're not just drugs and alcohol. People say that they feel like they're less compelled to shop, less compelled to drink coffee. How significant is that?
You know, it's really fascinating, and it potentially is significant when scientists and physicians are looking at these hormones, these medications that are acting, these GLP-1 agonists. We've been talking a lot, Diane, about how they act in your gut. Now comes the conversation about what it may be doing in our brains when it comes to addictive behavior. And one theory is that it may actually decrease the satisfaction, that dopamine response that people get, whether they're drinking an IPA or they're going online to shop or gamble. So it is fascinating. And it's kind of just letting us realize that as we use medications, there's more and more side effects or reactions that may happen in the same way that these medications were first created to fight diabetes. And then all of a sudden, researchers are like, whoa, people are getting weight loss. What's going to happen next? So it's important that as we see these proposed benefits, we're also paying attention to the unknowns and potential side effects.
It's still early days for all of this, too. So what other treatment options are available for substance abuse disorders?
Well, the most important thing that people can do if they have a concern about substance use disorder is talking to a trusted friend, colleague, anyone it may be, to push you to go talk to a healthcare professional. And there are proven treatments, regardless of what substance you're on, whether that is medication, counseling, cognitive behavioral therapy. The first and most important thing that people can do is go and seek help. And it's important to not just look at headlines or anecdotal evidence. You know, one of these studies actually looked at social media posts. That is the hallmark of anecdote, people self-reporting, but that if you're suffering from substance use disorder, you don't just look at these reports and think that works for you. Individualized treatment is best.
There is a lot out there on these drugs right now and a lot of hope being raised for what they can do, but also, as you mentioned, a lot of side effects. So how should people evaluate whether or not they are a good candidate for Ozempic or a drug like it?
Oh, hope is a good thing. I will stand by that. But you're right. As we look at headlines, we're starting to see that semaglutides are linked to a decreased risk of stroke, heart disease. Now we're talking about alcohol use disorder, in addition to type 2 diabetes and in treating weight gain and obesity. And what this has led to is a lot of people seeking them for off label use or in situations when they may not actually need them. So what's important is that people remember that overwhelmingly, these medications are FDA approved for type 2 diabetes and obesity or a certain amount of weight gain. And it's important that you take them under a physician's guidance because there's a lot we don't know in terms of long-term safety, efficacy, and dose response for some of the off-label use. So it's best to stick with the protocol and do what's safe for you. But I'm proud that anyone out there who needs help is having the conversation.
All right, love it. ABC News medical contributor Dr. Alok Patel, we're glad you are here to add facts to that conversation. Always great to have you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.